And now, well, good morning, everyone here.
Mi mamá
My name is
Marti,
Mirna
soy
Marti.
asesora regional
I
en lo
am
que
a
es
regional counselor of
sistemas de
PAHO
información y salud
in
digital en la unidad
Information
de sistemas,
Systems
información
and
y salud digital que tengo
Digital
a
Health
cargo
in the unit of Digital Health and
el
Information Systems that
programa
is
de
in charge of this
alfabetización
program
digital de
of
la OPS
digital
dirigidas
literacy of
a
PAHO.
un
Welcome
nuevo
to a
webinar, en
new
este caso,
webinar, in
de
this
un tema
case,
tan importante como
of
es el registro
such an
civil,
important
los sistemas de
topic
registro
like
civil y
the
estadísticas
systems
vitales,
of
con
civil
especial
registry and
saludo
vital
de nuestro
statistics,
jefe de
with
unidad,
special greetings
Marcelo
with the chief of
D'Agostino,
the
y el
unit,
coordinador del
Marcelo D'Agostino,
departamento,
and the director of the
Sebastián
department,
García, está
Sebastián
hecho hoy.
Garcia, and
El
the
doctor Víctor
facilitator is going to
Hugo
be Dr.
Álvarez
Victor Hugo Alvarez
Castaño, y el
Castaño, and
moderador
the
Juan
moderator
Cortés
is going to be
Escalante,
Juan Cortés
asesor
Escalente,
de temas de
uh,
evidencia, inteligencia y
assessor
regulación
in
en
topics
salud
of
en Colombia, en
intelligence and
Nueva
use of
Colombia. Así que
health in the
los
office
dejo
of
en
PAHO,
este
Colombia.
momento
So I'm
con
going to leave you
Víctor Hugo
guys
para que
right now with
facilite
Victor Hugo
la actividad.
so he can help you with
Bienvenido
this
nuevamente.
activity. Thank you. Welcome,
Adelante, Víctor
everyone.
Hugo.
Muchas gracias, Mirna.
You have the floor, Victor.
Es un
Thank
placer
you,
para mí
Mirna. It's a
hacer
great
la
pleasure for
introducción a
me to
este
be
webinario
here introducing
que
this webinar
se ha denominado
that
Registro
is
Civil y
being
Estadísticas
called
Vitales en la era
Civil
de la
Registry and
interdependència
Vital
digital.
Statistics in
Y
the era
es el
of
primero de
digital
los webinarios de
interdependency, and is
ciclo
the first of the
formativo
webinars
dedicado a
of a
aquella
training
transformación digital
cycle
de los
focused
registros
on
civiles y
digital transformation
estatísticos
of
que
civil
desarrollaremos
registries
durante
and
el resto de año.
vital
Y
statistics
esto
that
bajo el
we're going to
entendido de
develop
que
in the
los
rest of the year.
sistemas de registro
This on the
civil y
understanding
estadísticas
that the
vitales
systems
son
of
la base
civil registry and vital
fundamental para
statistics are the
garantizar el
fundamental
interés
base
de
to
ciudadanos
guarantee
y
the citizen
generar
rights
políticas
and to
públicas con
generate public
evidencia,
policies
basados en
with
evidencia.
evidence
Cuando
or
hablamos de
based
la
on evidence. And when we talk
digital,
about
estamos
digital
refiriéndonos a la
interdependency, then we are
interconexión
talking
estructural entre
basically about this
personas,
structural
entre
connection between
gobiernos,
people,
entidades
government,
y sistemas
entities, and
tecnológicos en
technological
un
systems
ambiente
in
digital
a
cada
digital
vez más,
environment that is each time
más desarrollado
more
y que exige
developed
pues
and
una
that
cooperación
demands basically
multisectorial.
a
En el
multi-sector
contexto de los
cooperation
registros
in the
civiles y las
context of
estadísticas
civil
vitales,
registry and vital
el,
statistics.
el- la interdependencia
The
digital
interdependency,
se
digital
refiere
interdependency,
a
is
esa
talking about
obligatoria
this
integración entre el registro
mandatory
civil
integration
y los
between a
sistemas
civil
de
registry and the
identidad
systems
digital,
of digital
así como
identity, as
con los
well
sistemas de
as with
información
the
en
systems
salud,
of
como por
information in
supuesto
health
debemos de
as the
dar
main
conocer
providers
sobre
of
registros
this
vitales
information about
y
vital
con la
information,
clasificación
and
internacional
with
de
the
enfermedades
international
como el
classification of
estándar
diseases
básico de salud.
like the base
Entonces,
standard
esto no
for
es una
health.
opción,
So
es
this is
una
not
necesidad, es una
optional, this is actually a
obligación, por
need,
lo
this
tanto,
is
todos los
mandatory,
sistemas
and hence all the
tendrán que
systems would
conformar un
have
ecosistema
to
digital
generate
que
a
pueda
digital
garantizar los
ecosystem that
derechos
needs to
fundamentales
guarantee
desde el
the fundamental
nacimiento hasta la
rights
muerte de las
from the
personas
date of
y
birth
que
until the death
provea
of people,
de
and that
forma
could provide
automatizada
in an automated
información
way
confiable
the
y
trusted
servicios
information and
inclusivos.
services that are
Ahora, en la
inclusive.
región de América Latina y
Now,
el
in
Caribe,
the
pues
Latin American,
enfrentamos
the Caribbean region,
unos
then
fuertes
we are
desafíos
facing
para esa
some serious challenges
transición
for this transition
hacia la era digital de
towards
los registros
digital
civiles.
era of these civil
Tenemos, por ejemplo,
registries,
la
civil
fragmentación
records. We
institucional, que
have
es
the
bastante notable
institutional
en el
fragmentation that is
subregistro,
extremely visible in
persistente
the
todavía
under
en la región,
records that is
y la falta de
persistent in the
interoperabilidad
region,
entre el
the lack
sistema
of
de registro
interoperability
civil,
in the system
los
of
sistemas de
civil
salud y
records,
las
the systems
plataformas
of
de
health,
identidad
and the
digital.
platforms of
Por
digital
lo
identity.
tanto, se requiere
Hence,
para acelerar
it is
estos
necessary to
desafíos
overcome these
ser
challenges
capaces de romper
to be able
silos,
to break
establecer
silos, to
relaciones
establish
sinérgicas entre las
some synergy in
entidades
the
y
relations
priorizar la transformación
between these
digital de
and to
nuestros sistemas
prioritize
de registro
these
civil y estadísticas
systems
vitales.
of
En
civil
este panel,
registry and
entonces, estamos
basic
buscando
statistics. In
la
this panel,
reflexión
then, we are
colectiva
looking for the
sobre la
collective reflection
interdependencia
about
digital
interdependency,
de los
digital
diferentes componentes
interdependency
del
on the
registro civil y
different
estadísticas
components
vitales que
of
están
civil
imbricados
registry
todos
and
los
the
miembros, por supuesto,
statistics,
de nuestra
vital statistics. We have all the members of our community of practice for the civil registry and other people that might want to be integrated in this work of reflection about this process that is new for all of us in most of the countries, and that, well, is going to warranty the inclusive services, trusted data, and protection of fundamental rights. And without further ado, then, I'm going to give the floor now to Juan Cortez so he can introduce the invited speakers today that are going to present these key elements for this reflection. Thank you very much. Thank you, Victor. And well, next we are going to provide a presentation of, oops, it seems like he has some issues with connection. But in the first place, I'm going to introduce Catherine Contio. She is a counselor of the systems, advisor of systems of information and digital health of the systems of digital health of the Department of Evidence and Intelligence for the Action of Health of the PAHO office. Thank you very much. Is based in Washington. And the next speaker is going to be Dr. Javier Vargas Herrera, a physician, master's in epidemiology and doctor from the National University of San Marcos, uh, some studies of the University of Washington, and he has worked as General Director of the National Office of Statistics and Informatics of the Ministry of Health of Peru. He's also the Director of Sanitary Intelligence of the Peru and the Chief of Office of Technology of Information of the National Institution of Information of Peru. He has been a coordinator of the country level of this Bloomberg initiative, Data for Health, for the system of registry, civil registry, and vital statistics. Currently, he is working as the main professor of the Department of Preventive Medicine and Public Health of the National University of San Marcos, and as an consultant of the Pan American Health Organization for System and Transformation of the Health System in the Americas. Next speaker is going to be the psychologist Manuel Yañez Hernandez. He's an instructor in the family of classification, international classification of the WHO, and amongst which we have the CA number 10, number 11, and also the International Classification of Functionality. Currently, he's working as Subdirector of Classification of Information in Health, and the General Direction of Health Information on the Health Secretariat in Mexico, and he's working as a technical secretary of the Mexican Center for the Classification of Diseases, this collaboration center of PAHO and WHO. He's been a technical responsible for the processes of implementation, updates of the CS in Mexico, as well as national coordination of automated systems, coding for mortality through the IRIS platform in the health system. Currently, he is the focus point for the implementation plan of the CA 11 in Mexico. We're going to give the floor now to our first speaker, Catherine Contio. You have the floor now, Catherine.
PAHO's vision and actions in health data management. The mainly focused what is the PAHO's view on the civil registration and vital statistics in relations to the data management and our work. PAHO has over 60 years experience on working on the vital statistics. It started from the 1950s and 60s to support the improved vital statistics and cause of death certification. And we have moved and transitions over to decades from the paper-based system to digital transformation, which I'm going to talk a little bit later, what is in our focus on this. But this is a short timeline, on this slide, to see, like a little bit the transition. And we have had the several plan of actions, the strengthening vital statistics, And the most recent one is focusing on the 2023 to 2030 under the IS4H that I will talk a little bit later. We have still gaps in civil registration and vital statistic systems. On a paper, the region of the Americas looks very good compared, especially in some other regions in the world. We have very quite high coverage of the death registrations and coding. However, the timeliness and data quality are still quite a bit of an issues. And although we do have almost 90% of the registered deaths certified, we are still missing 1.3 million vital events yearly. There are the data quality issues and the timeliness of reporting. There are still blind spots in decision making. And this translates that in 2022, when we had a survey, just 12 out of 35 PAHO member states deliver high quality mortality statistics and publish it in within 2 years. So we do have still a bit of the gap that we would need to improve. Also, the COVID-19 provided, the lessons, how well actually the CRVS system works in Americas. There's a picture of from the Amazonas, the cemetery. There was a huge increase of deaths in the region of the Americas, as we've seen in globally as well. And that meant that the timeless collapsed of the notifying and certifying deaths. There was a certain ill-defined causes for deaths. There was also that the certification fell over 30%. And one of the reason for this was obviously excess mortality, but also that a lot of the processes were still in paper based, and when the people were working from home and offices were closed, it was very difficult to compile the data and to have fluent the data flow. So what was the lesson first that we really would need to focus on more on the digitalization of the system, that we would be ready to work on timely manner for the notification of birth of deaths, like even the case of the any pandemic or the emergency situations in the future. Our the view from the PAHO as a health agency, that we work how we can improve the health sector contribution on the overall civil registration of vital statistic systems. There's the diagram in this slide, which is very commonly used. It describes the health sector, the role and overall role of the different agencies in the total CRVS architecture. I have highlighted in the yellow highlighter the sources, how what information is provided by the health sector. So we, as a health fundamental provider of the information feeding the civil registration, because the source of truth of the live births and deaths and fetal deaths comes usually from the health. So health sector is also obviously beneficiary of on the whole civil registration of vital statistic system, because a lot of times vital statistics being coded in and compiled at the statistical office in our region, and the health will use this information also for the decision making. Our work in PAHO is aligned with all different global and regional commitments with the civil registration and vital statistic base. One of the famous and important one is obviously Sustainable Development Goals. The one of the goals 16.9 is the guarantee legal identity for all, where the health systems plays a crucial role, because there's no legal identity if the person don't get the birth and death certificates. We also align our work with the WHO Global Digital Health Strategy, And most importantly, the CRVS work is embedded in PAHO digital transformation agenda from the 2021 and 2030. This is a high-level vision and guiding principles for digital transformation of health sector in the Americas, and very importantly in our work is guided and embedded in IS4H plan for action, which is operational framework, how we implement the digital transformation in information systems in the Americas. It's include the governance, interoperability, and innovation. And our CRVS work is embedded, under this strategy. So a little bit more in detail what the IS4H do. So we see that the CRV is an enabler of the PAHO IS4H strategy and also the PAHO Forward 3.0. CRVS systems, they benefit, all the work that we are doing under the IS4H because we are strengthening the governance and leadership, also the CRVS national committees. We are supporting the governments and member states to build interoperable digital infrastructure. We are working with the data quality and open data culture and data sharing. We focus a lot of our work to supporting the countries to adopt the innovations, including artificial intelligence, mobile application, and user-centered design. And by doing this, our vision is that by 2030, we would all have integrated standard-based health information systems in all PAHO member states. And the strategic field in CRVS really within this is that we don't want to have the separate roadmap. We want to have a one roadmap with the integrated health information system where the civil registration and vital statistics are integrated under this architecture. We would have one roadmap and one budget to avoid silos. And we see that the CRV benefits from all the IS4H work, legal governance, and interoperability rails. What we actually do, the specific, the project, the focus in specifically for the civil registration vital statistics, we do continue supporting the routine strengthening as we have done the past 60 years. Regional reporting, coverage, and quality across the Americas. We report this regional data for the WHO headquarters in Geneva for the compilation of the global statistics. We support the sustainable development indicator reporting and comparability. We support technical standards and the legal reviews. And we do a lot of application and digital tool support, including DHS2 models for the mortality, also the integration of the mortality and serious data flows with the existing information systems. We work a lot of the capacity and networks. We do the ICD coding support. We have established ICD national focal points in almost every member states. I think the coverage is at the moment, like around 85%. There might be the 2 or 3, the member states that have not still notified, the names. We do have the CRVS community practice, including webinars and shared tools. And we do have the Secretariat and CRVS Partner Forum for the Americas among the different international agencies. We want to link health registry statistics, ID work, and digitalization among the partner agencies. And we do have collaboration with the WHO FIC collaboration centers. CEMESE in Mexico is one of the example of this. To harmonize standards and the trainings across the region. We work, and lastly, evidence and analytics and how to use the CRVS data for the decision making. One of the innovation and future ready tools that the work that we are doing is a lot of work with the enrolling the ICD-11 coding work. In the region, we help the countries embed ICD-11, which is a digital coding tool with the APIs to the existing application and workflows. We work with the business process mapping, also for the end-to-end digital workflows, birth and death registration, certification, and coding. And we also have some innovation work. We try to build artificial intelligence enhanced tools for the debt certification, also work with the mobile solutions and digital public goods for the CRVS space. I wanted to also to share this. We do a lot of knowledge sharing, and one of the new thing that we have is the Pan American um, journal for the public health, and we just established in May 12 the special edition for the CRVS related publications. And now we have 9 publications published. They are available on our website. The topics are ICD-11 readiness, digital area pilots, mortality data quality, region strategies. They are open access articles, and we have an ongoing submission. So I would like to welcome everybody to go and look, and read, the existing, the new publications from our region. And also, if you're interested, look, how to submit it your own article. It's ongoing. And the last slide that I wanted to say in the snapshot on our partnerships in 2025, we are not working alone. We work in a network with the many different agencies. As I mentioned, we are the secretariat for the network of the partner agencies on CRVS in our regions, including many, many organizations from the UNICEF Organization of American States, Bloomberg Philanthropies, development banks, etc., and WHO. And just a highlight for the couple, the four, the global meetings that we have participated and presented our the work in Americas. It was a CRVS partner meeting in New York, hosted by the Bloomberg Philanthropies. We hosted in Trinidad and Tobago Caribbean Technical Partnership meeting in May, developing the Caribbean roadmap, the CRVS harmonization across the region. Our department director presented in PAHO in Global CRVS meeting in Istanbul now in September. We contributed, the building the global compendium of CRVS indicators. And now in October, we have the couple high-level meetings. Dr. Juan Cortés Escalante is going to present the PAHO in a meeting in San Salvador, where is Miniature Justice across the region. They have a large meeting, and we will have a panel where how the health is contributing the overall civil registration systems in the region. We also have the large digital health transformation meeting in the end of the month, also in San Salvador, hosted by IDB, and PAHO is contributing this, and we will have the entire the session on Caribbean roadmap, on the CRVS improvement, and lastly and importantly, we are participating in WHO International Classification annual meeting in Geneva to presenting our work in the region in mid-October. So we are contributing a lot of work globally, although our focus is in Americas. And thank you. That was our the work in a nutshell. We obviously do much more, but this was the main activities. Over to you, Juan.
Muchas gracias, Katri. Pasamos
Thank you very
la
much,
palabra
Catherine.
ahora para la
And we are going to
presentación
give
del
the
doctor
floor
Javier
now for the
Vargas
presentation of
sobre
Dr.
la
Javier
transformación
Vargas
digital del sistema de
about
registro civil
the
y
digital
hereditario en
transformation
México.
topic of
Por favor, doctor
civil registry
Javier.
and vital statistics. Dr.
Bien,
Javier, you have the floor.
muchísimas gracias,
All right,
Juan.
thank you very much, Juan.
Y bueno, vamos a conversar sobre
And when?
cómo podemos
Well, we're going
lograr
to
una hoja
discuss
de ruta
about
para la
how we can
transformación
create a
digital de los
roadmap for
sistemas de
digital
registro civil
transformation of this
y estadísticas vitales
civil
en las
registry
Américas.
systems and
Y
vital
para eso
statistics
primero
in
nos
the
preguntamos qué
Americas.
es la
And for
transformación
this, we are
digital.
asking
Ya
ourselves first, what
comentó
is digital
algo
transformation?
Catherine
Catherine
already
already shared a
shared
little
a
bit
little bit
about
about
this, and
this,
it
and it
has
has
to
to
do
do
with
with
the
the
change
change
of
of
work
work
of the
of the
organizations,
organizations,
adopting and
adapting and
integrating
integrating
these digital
these digital
technologies,
technologies,
reinventing
y sobre
activities,
todo
operational models,
revisar
and
la cultura
especially
organizacional
checking the
con el fin de
organizational
lograr
culture
innovación,
with the objective of
eficiencia y valor
generating
añadido, ¿no? Si aplicamos
organization,
estos
innovation,
principios
efficiency, and added
a
value.
los
If we
sistemas
apply these
de
principles to the
registro civil y
systems
estadísticas vitales,
of
es
civil
pertinente
registry
recordar
and vital
que estos
statistics, it's
sistemas
important to remember
son sistemas
that
gubernamentales
these systems
que se
are government
sustentan
systems that are
en
based on
las oficinas de los
the
ministerios de
at
salud,
the offices,
de los
basically,
registros
of
civiles
the
y de
health
las oficinas
ministries,
nacionales de
of
estadística.
the
Y tienen
civil
que ver
records, and
principalmente con
also
el
the national
acceso a los
statistics
bienes y
offices.
servicios
And it has to do with
públicos
the access
que
to
el
the
Estado puede
goods and
proporcionar a los
services, public goods and
ciudadanos.
services that the state can provide to the
Y
citizens.
al ser un
And
sistema,
as
estos tres
this is a
principales
system,
actores tienen que
these three main
actuar
stakeholders need to
muy
act
articuladamente
in a very
para
articulated
lograr
way
la
so they
notificación
can manage to be
de
notified
extremo a extremo, como se mencionaba,
from
desde la
end to end, as it
notificación
was mentioned,
de los hechos vitales
from the point
hasta
where they are notified of
la
the
publicación de las
uh,
estadísticas
vital
vitales para la toma
information
de
until
decisiones
this
en varios
vital
niveles, ¿no?
statistics is published
Eh,
for decision making at
¿Qué
different
perspectiva
levels. So,
se
which
busca con la
perspectives are
transformación
we looking for
digital
with this
en
digital
los países de las
transformation
Américas?
in the
Bueno,
countries in the Americas? Well,
hay que revisar el contexto
we need
en
to
el
check the
que se
context in which
desarrolla
we are developing
el trabajo del
this
sistema de
work
registro
of
civil y
this
estadísticas
civil
vitales en cada
records
uno de los
registry
países.
and
Lo que se ha
vital
observado es que
statistics
si
in the
bien existen
countries. And what we have
países
seen
que
is that
tienen
even though there are
sistemas
countries
de registro
that have
civil y estadísticas vitales muy
civil
fortalecidos, como
registries
puede
and
ser
vital
Chile
statistics very
o
strong,
Brasil,
like
que están basados
Chile
en
or
el
Brazil,
papel,
that are based
la
on
mayoría de
paper,
los países que persisten en el
most
uso
of
de
the countries
formularios
that
en
insist
papel
in the
para la
use of
notificación
paper-based
o para el
forms
recoge
for
primario del
notifications
dato de
or
un
collection of
nacimiento o
data
de una
of
muerte,
date of birth or
está asociada a su
disease
registro
of
y a baja
basically
calidad
the
de
date
los
of death
datos.
is
Hasta 6 de cada 10
connected to
muertes
sub-registry and low quality of data.
pueden no ser
6 of
registradas
every 10
en algunos
deaths
países a
might not
nivel
be
global, ¿no?
recorded
Y
in some
también
countries around the
existe
globe.
mucho
And
retraso en la
we also
producción de
have a lot
estadísticas
of delay in the
porque el
production of
papel tiene
statistics
que
because paper
ser transcrito
would need to
a
be
otros
transcribed
sistemas
to other systems.
y existen limitaciones
And
también,
obviously,
por
there are
tanto,
limits
para los ciudadanos en la obtención
for the
de sus
citizens
documentos
when
oficiales
obtaining
de
these
identidad, ¿no?
official
La
documentation
implicancia de la
about
transformación
for their
digital
ID.
tiene que ver
The
con
digital
modernizar
transformation has to do
estos
then
registros,
with
con introducir
modernizing these registries,
la
these records,
automatización y el
with
análisis
introducing
avanzado de
automation and
datos.
advanced
O sea, si
data
nosotros
analysis.
logramos
So it means that if we
pasar de los
manage to
formularios de
go
papel a
from
los
these
formularios
paper-based forms
electrónicos
to some electronic
y en
forms
línea,
and
el
online
registro en
forms
línea, vamos a
in this
poder
online registry,
introducir análisis
we are
avanzado de
going to
datos
introduce
con inteligencia artificial,
advanced
con
data analysis with
codificación
artificial
estandarizada de
intelligence,
causas de
with
muerte, va a
standardized
ser más
codification
fácil
of reasons for death.
incorporar o introducir
It's going to be
la
easier
CIO-11
to
y, por
introduce
ejemplo,
the
DORIS para la selección
CO11
automática
and DORIS, for
de las
instance,
causas
for
de
automatic
muerte, ¿no?
selection
Entonces,
for
se puede
death
mejorar
reasons.
la
So it
oportunidad, la
can improve
precisión
the opportunity, this
de los
precision
datos.
of the
No
data
partimos de
that we
cero.
have. We're not
En las
starting from
Américas
scratch. In the
existen ya
Americas, we
sistemas
have
que
certain
funcionan
systems
en
that are
Perú,
already working in
el
Peru, for
certificado de
instance,
nacido vivo en línea, el
the
SINALEP,
online
en
uh,
Colombia,
birth
RUAF,
and
en
life
Uruguay,
certificate, in
Seven
Colombia,
Digital, en
RUAF,
México
in
se
Uruguay,
está
7
expandiendo,
Digital, in
el
Mexico has been
CEP, en
expanded,
Ecuador, Revitsia,
in Ecuador,
son sistemas
Revitsia. These
que
are
tienen ya
all
formularios
systems that already
electrónicos,
have
tienen
online forms,
algunos, como en el
electronic forms.
caso de Perú o Colombia,
Some,
ya
as Colombia or
coberturan
Peru,
más del
have a
95%
coverage of
de
more
las
than
muertes
95% of deaths
de manera electrónica y en
in an
línea, y
electronic
en otros
way and
países están
online, and in
restringidos
some
aún
countries they are restricted
a los sistemas
to
hospitalarios, ¿no? Pero la
the
mayoría de los
hospital
países
systems. However,
todavía
most of
sigue
the countries
registrando
are still
en
recording
papel.
on
Tener
paper.
un sistema de
So,
información y
having a
formularios
system of information of
electrónicos en
electronic
línea
forms
facilita la
online is
interoperabilidad
going to help with
entre
interoperability
los principales
between
actores
the
del sistema de
main
registro civil y
stakeholders of
estadísticas
this
vitales, pero dentro del
system,
propio sector
civil
salud
records and
puede
vital
favorecer la
statistics, but
vigilancia
within the
epidemiológica. Por
even the
ejemplo,
health
durante el
sector
COVID
could
ha sido muy
help during
importante contar con
epidemiologic
un
monitoring.
sistema de
During COVID, it
información
was
en
important to
línea para
have an
verificar
online system
el
to
exceso
verify
de
the
la mortalidad
excess
por esta
of
enfermedad y
death,
por
for
otras
instance, due to this
enfermedades,
disease and other
pero
diseases.
también
However,
cuando
when it strengthens or if there are some systems of medical records online or I don't know, this interoperability is going to allow it so we can establish a series of algorithms that are going to make it easy for decision making in public policies. And from a point of view of the civil records, this is going to help with the process of identifying and IDing someone. And in the statistics offices, they are going to receive data quicker. The online records allow to apply some business rules that help us receive some valid diagnosis, safe diagnosis, controlling some aspects, for instance, that when we have transcription on paper, is this is providing a lot of uncertainty about the death dates, for instance, of people that passed away, or to look to establish a connection of mortality and maternal mortality, checking the deaths on women's infertile ages. Mm. And it helps the records when we have some other catalogs, like the ones for location or even establishments of public health. But fundamentally, as this is going to be introduced later, and Manuel is going to tell us a little bit more about it, we can include this codification with CE11 that is providing more detail about the cause of death and also using Doris as software that automates the coding and selection of the cause of death. For civil records, it could help with expanding, leaving some agencies in the health institutions and validate in a more efficient way the data of the citizens so they can access in an easier way the different ID documentation they need, establishing some offices to respond in these spaces. And one of the issues that we need to where we have to pay much more attention has to do with security, safety, and privacy of the data. In Peru, we had some experiences referred to this topic of safety, data safety of this civil records, civil registry. And at the same time, there was an interesting reaction to favor the implementation of more security to the access of this safety. From the access based on roles, double authentication, and even the use of biometrics and the certifications and digital signature. And even though the process of a digital signature and birth certificate or death certificate could probably look mm, even more cumbersome because it demands more resources for people. And in Peru, we have seen that coverage has not diminished and it has actually favored the quality of data that we're receiving. And from a point of view of statistics, the forms of online registry, online records can favor decision making that are timely and favoring the vigilance on public health, providing information for planning, executing, monitoring, and evaluating as health interventions and the information bulletins, demographics, and those that can be provided by the Ministry of Health, as well as the national offices of statistics, could be more timely in the short term, and they could help identify quickly some situations of excess of death, for instance, due to specific causes. Now, some of the factors that we need to evaluate constantly to be able to implement these systems of electronic registry and online registry have to do with the context in which this is developed. It is important not to lose sight of the technological infrastructure, these communication networks that are had by each of the countries, which are the different levels of connectivity connectivity, the connection with internet and mobile um, internet as well as cell phone connection. We don't want to go from a technology based on paper and going to online connection to be a factor that excludes actually the different populations, let's say rural populations that are further away from the urban centers on the one hand. And on the other hand, it is also important to provide constant training and to provide also digital literacy for the citizens with this digital literacy. And being a system that is based on these three main factors and other institutional stakeholders to go from technologies based on paper to these kinds of digital technologies is going to require a lot of institutional arrangements of working on governance. They require a lot of coordination between these three main stakeholders and others so they can provide sustainability and public trust as well. And also that these could be well aligned with the uh, government policies, electronic government that we have in each one of the countries, right? And now, what should we consider based on everything that we have mentioned so far if we are going to decide on having this passing from these paper-based forms to digital forms to record these vital activities or situations, we have to evaluate the reach of the scope of this project. If this is only going to reach the context of health or population, if this is going to cover all the different contexts, be it public and private as well, urban, rurals, and how we are going to continue with the use of paper, especially thinking about digital inclusion in these areas where it is not possible yet to collect data in an electronic way. And definitely each new application is going to should contribute to strengthen the system in general. We shouldn't stop considering these 8 principles for the creation of roadmaps of digital transformation, these 8 principles established by PAHO, as well as the ways in which this is organized, as it was emphasized or highlighted by Katri. These health systems are based on the first part of this notification and registry, medical records of birth and death certificates, deaths of fetus or unborn babies, and basically based on all of this. At the time of wanting to generate a roadmap, it is necessary to generate a situational mapping the current situation, identifying the different stakeholders and these workflows. I would say even to think about the forms that are used, physical and digital. Many times in the same country, we could have, even though we could have an official form to notify deaths on paper, we could also have some other forms that are used, for instance, by the CSI or the social security systems. So it is necessary to generate an inventory of all of them and on a map to generate and be able to identify the gaps, the problems of coverage, and analyzing normativity of what the legislation authorizes. And based on this, to start generating a roadmap for digital transformation that can go through these 4 main stages, designing which are the ways to apply in an informatic context, understanding the scope and the context with the participation of the different users, how this new system is going to be able within the development to consider interoperability that is going to have. And once we have a prototype, to be able to see where we can test it basically. And finally, how we are going to escalate it, how is we are going to have this plan for implementation basically. And obviously to take into account as well that when once we start, this is not going to be easy. We are going to need to have some sustainability, and this has to do a lot with sensibilization of the authorities and the health staff with training and digital literacy, as well as the strategies, incentives, recognitions, and identifying as well the different resistances to change, so we can generate a culture and promote a culture that does not pull us back, actually. So then to close this, digital transformation is vital to guarantee this right to identity, that there is a need to strengthen and coordinate the different stakeholders of the system, amongst other things, from the United Nations, WHO, PAHO. Is fundamental to have a committee that is based on national vital statistics, and at that level decide how is the process going, and to consider, amongst others, one of the most important ones, that is the focus on human rights and inclusion, because the idea is for no one to be left behind in this process of digital transformation. All right, thank you very much. That's what I wanted to share with you all.
Muchas gracias, Javier. Muy
Thank you very
importante.
much, Javier.
Ahora damos
Extremely important
paso
information. And now
a
we are going to
Manuel
give the
Yáñez
floor
Hernández
to
con su
Manuel Yáñez
presentación
Hernández with his
CE11 como
presentation,
componente fundamental
CE11
para la
as a fundamental
digitalización de los
component
certificados de
for
nacimiento y muerte.
digitalization of birth and death certificates.
¿Qué tal? Gracias.
Hi, everyone. Thank you very
Muy buenos
much.
días a todas y
And
todos. Muchas gracias por la
good
invitación
morning, everyone.
a esta
Thank you very much
actividad.
for inviting me for
Yo
to
les voy a
have this
hablar
activity.
acerca de la
We are going to
CE11
talk a
como
little bit
este
about
componente
C11
fundamental
as
para
this fundamental
la
component
digitalización de los certificados
for
de nacimiento
digitalization of
y
birth and
defunción, por
death
mencionar algunos,
certificates,
y
just to
cómo
mention
esto se
a
enlaza
few, and
directamente
how
con la
this is directly
importancia
connected
de los
with the
sistemas de registro
importance
civil y
of
estadísticas
these
vitales en nuestra
civil
región.
registry
Eh,
systems and
Hay
vital
que
statistics
tener
in
muy
our region, and
presente
we need to
esta
keep in mind
modalidad de
this
identificación
modality
en
of
cuanto a la
identification
modernización de
as
la
well
CIE
as
entre
modernization
la CIE
of the
10 y la
CA
CIE 11.
between
No es
CAI,
únicamente
CIA 10 and CIA
una
11 is
actualización
not only an
de
update
la
of
clasificación en sí,
this
sino
classification
una
itself.
perspectiva
However,
totalmente
it's
digital
also a
y moderna. Es
complete
decir, la
digital
CIE 11 ya viene en
perspective.
una
It means
plataforma
CAI
digital, una
11 comes through in a
transformación digital,
digital
y
platform.
está
A digital
diciendo poco a
transformation
poco
is what
adiós
we are
a
saying
los
little by
clásicos
little.
libros
We're saying
verdes hablando
goodbye
de la
to
CIE
these
10
old
y estamos
green
transitando
books
ahora
talking
con un
about this
navegador,
CIA
una
10,
herramienta
and
de
we are now
codificación e
using a
incluso una
browser,
guía de
a
referencia para
coding
su
tool, and
uso
even a
de manera
reference
digital
guide
en PDF
for
para el
its
idioma
use
español.
online in
Entonces,
PDF
esto nos
for
habla de una
the Spanish
necesidad
language.
de
So
buscar y
this basically
completar la
provides
interoperabilidad
this
de
need of
sistemas.
looking for
¿Y
and
esto qué nos va a conducir? ¿Hacia
establishing
dónde
well
vamos a
the
llegar?
interoperability
O
of
el
systems.
plus que va a tener esto
And
va a ser la
the plus that this is going to have
interoperabilidad
is going
semántica,
to
es
be
decir,
semantic
con un modelo
interoperability. So
digital hay
this means
términos
with a digital
únicos
model, we
definidos
have unique defined
jerárquicamente y con la
terms
bondad de
that are
tenerlos en
defined
múltiples
in a
idiomas, lo
hierarchy,
cual
and
nos va a
we have
permitir tener
the
esta
good option to
calidad
have them in
al
different languages,
intercambiar
which is
esta
going to
información
provide
en
this
salud y a
quality at
su
the
vez
moment
con
of
los registros
exchanging
civiles.
information in health as well as
Eh,
civil
pero
records or registries.
también
And
importante destacar
it's also
y
important to
enfatizar
highlight
a qué
and
nos referimos en
emphasize
este
what
contexto
we
de la
mean in
CIE
this
11 en
context of
cuanto a
CIA
interoperabilidad
11
semántica.
about semantic
Dicho
interoperability, and
pronto,
is
es la
that,
capacidad de
in
diferentes
short,
sistemas de
this is the
intercambiar
capability of different
información con un
systems to exchange
significado
information
compartido.
with a
Aquí
shared
tenemos esta
meaning.
posibilidad
In
de
here
que
we have this
los
possibility
clínicos,
that
los
the
médicos, los profesionales
clinicians,
de
the
la salud
physicians, health
puedan
professionals
identificar
can
su
identify
término médico
basically
clínico de
this
manera como
medical
nuestra
term
ciencia médica
the
lo
way in which
identifica y
they
a su vez
identified from
se
a
puede
medical
buscar el término
perspective, and they can also
e
look for
identificar
the
el código
terminology and
dentro de la misma
identifying
CIE
the
11.
code within the
Esto nos va a
CIA
ayudar no
11.
solamente
This
para
is going
la
to
libre
help
praxis de
not
la
only
comunidad
for the
médica,
free
sino
praxis
para la
of this medical
compilación y
community,
que
but
por
also to
añadidura
compiling
y en
and
automático
in an
salga
added value, and
codificado, es decir,
automatically is
la
going to have this
perspectiva
codified.
o el
It
uso de
means
la
the
CIE
perspective
para
for
los
use
médicos
of the
no se
CIA
busca que se
for
conviertan en
physicians. We are not
codificadores
trying to
en lo
make it
absoluto. Lo que se
as
busca
so
es
they are
que usen la
codified.
CIE
What
11
we are looking for is
para
for them to
que
use the CIA
puedan
11 so they can
determinar su diagnóstico y
establish
en
their
segundo plano por
diagnosis,
añadidura
and in a
saldrá
second level,
codificado
an added way is going to be codified and very relevant, of course, from the perspective of the electronic clinical point of view, epidemiological vigilance, certificates of birth, and disease, and the international comparison there as well. Also talking about specifically this topic of death, my partner Javier mentioned this a while ago, and is that this advantage that we have nowadays, and that is also part of this group of tools that is being promoted by the PAHO. We have Doris, and this is a tool that is going to help us use this death information, death certificate information, for instance, and also select the basic cause of death, responding to the technical perspective. Is a little bit more from a point of view and a task of the staff that is in charge of coding. With this system, then we are going to be applying the classical rules to establish the basic cause of SP1 of SPA and M4, and then I'm insisting on this because M4 usually is the most complex ones to code. And we even identified the need of a manual supervision, manual coder. So it means that there is not a percentage of 100, but it actually requires a percentage between 10 20% to generate a manual supervision, even though generating a modality of use of Doris that is going to use 10 of every 8 of every 10 certificates. That is going to be an optimal tool. And also, as we process the information, it's going to be able, together with other tools. Currently, we are working with an update of Codedit, where they are identifying the different causes established in the lines, and they can identify the inconsistencies on the ranges of age for certain situations and the lack of immediate notification at a global level. And this, going back to respond to the central point, what is this going to mean? Of course, we're looking for a perspective that is updated, modern, top of the line, of course, but at the end, this is going to help us have this data quality that is amazing, and of course, the necessary comparison, having more precise comparison and uniform, that is very important, so the death certificates and birth certificates are produced and show the realities of our different countries. CIA 11 allows for this with this level of detail, this granularity from a technical perspective, and also responding to the mandatory need that we had on this classification to update it not only from a clinical point of view, medical point of view, of new afflictions, new health situations, even new ways to classifying them, but also from a point of view that is digital 100%. Another thing, another important point there to understand this digital transformation, and within it the C11, we have a huge plus that nowadays the C11 is discussing, CIE 11 is discussing with different classifications that before the CIE 11 were kind of isolated. So even in certain technical points, they were countered about some technical perspectives. So now they are actually dialoguing within them, highlighting Nomad that is this is update that is being looked forward, HRIR and LOIN that is classifications of use that are connected to digital systems. Nowadays we are having this correct harmonization within the digital ecosystems of information and health, and they can be used at a national or regional level. Even if FIRE, FHIAR, there is a direct connection with this other link of this ways of use of other classification and terminologies. So this next one is also part of this line, and in several of the countries of Latin America, we are undergoing this transition at the level of implementation. And without a question, this is part, in an important way, of the perspective and the regional vision that IS4 Health has. Part of this modernization, the systems and the use of CA11 in the different scenarios It means from the health center all the way to the different units that are dedicated to process this that information that is going to the civil registries and records. It's important to have this landscape that is well defined. And as it was mentioned in the previous presentation, we have some progress already. And CIA 11 is providing with a lot of emphasis this base and is helping keep up with this regional agenda, national agenda, I have to say. We have several of the countries that are very well aligned to this need, mandatory need that we have, that is going to improve data quality from a point of view that is digital. And well, we are in this last part of this presentation. We are going to understand the evolution. It was mentioned a very good plus, that is the connection with other standards and classifications within the same classification, family of international classification. The connection with derivative classification as CEO is already established for these links, and the other disciplines, CIA 11 for mind issues and behavioral issues and neurodevelopment, amongst others. But beyond these families of classification, the expansion to other links and terminologies, as it was mentioned before, and between them we highlight is NOTMEC for these clinical purposes. CIA 11 nowadays has a model of clinical content that is completely digital from the point of view of the reference points of the WHO. Is considered a content model, and it also has an URI with each entity that at the same time becomes a decoding line, and it has a query and the codes. If we verify the browser, we have each URI of each function, and depending on the level of granularity. And here is also important to identify, and it's possible to verify this with um, different languages and a very multi-axis perspective to use it in different contexts and other processes. Then we have some local examples, and Javier was mentioning this expansion in other countries of the region, Brazil, Peru, but also in Mexico, we have this modality of use of this electronic certification of death that even it's a fertile use, so we can have a complete transition to the CIA 11. And anyways, it shouldn't be a process that is too complex, but it should actually be the same technical line that we should follow, and verifying and going to these routine processes whilst we are doing this transition. Nowadays, they are living paper-based certificates, and they get to this point of link these systems of death certificates. However, little by little, it's going to enter more and more this need of this system of digital records. And at the same time, we identify this with an excellent line with the implementation of CIA 11, talking about the international model and the cases that are being reported. It should not generate a deep impact because the physician is going to be able to report death reasons, death causes, as they had done before on paper. So basically, we are not looking to influence this determination in a concrete way to influence in one term or another. The physician is going to be free, report this, and at some other point of the process, they are going to be able to establish the basic cause due to the codification line. And of course, death certificates and birth certificates, apologies, where we identify these um, illnesses at the date of birth of the babies, talking, for instance, about semantic interoperability if it is reported perinatal hypoxia or extreme perinatal is a way to report it from a clinical point of view, but the way in which we classify it could be extreme early birth. And this is not part of the line, but it's also a good example, this digital certificate of disability that we have in Mexico that was generated 100% with the CIA 11, and it's possible to identify these causes why they are asking for these disability certificates, and it was managed from the beginning. So here's another example that we can share. And well, to finish with the benefits that we're going to have at the same time as using this goodness of this is aligning to this need of going towards these digital models that is going to help with the best decision making connected to the best guidelines of lives for health and civil registries and vital statistics, having evidence for using resources, diminishing this margin for mistakes that is possible, as I was mentioning, and to keep moving forward little by little, but um, with strong steps. To finish, CIA 11 is not only a classification, it's a semantic digital infrastructure. The implementation of these vital certificates should not be seen as an isolated process, but instead as a pillar for digital transformation and is part of this ecosystem of IS for health. And now Javier also mentioned that we agree on this, the need of investing resources of every aspect, identifying what we have, and doing some um, action making
Muchas gracias,
uh,
Manuel.
the
Las
depending on
tres
what we have.
presentaciones, como ustedes
Thank
ven,
you,
son
Manuel. The three
complementarias. Ha
presentations,
sido
as you
que se
can see,
ofrece
complemented CIA
parte
11 that is
semántica,
provided the good
guías,
semantic
rutas, ¿no?
basis,
Y todo el
the
trabajo que la
roadmap,
región está
and
trabajando.
all this
Entonces,
work
paso
that
la
we're doing in the
palabra
region.
para
Now we are going to give the floor
Víctor Hugo.
to Victor Hugo.
Muchas gracias, Juan. Bueno, no
Thank you
tenemos
very much,
tiempo
Juan.
para
Sadly, we don't have
exactamente para
more time
preguntas y
for
respuestas.
questions
Hemos
and
respondido
answers.
algunas
We have answers, a couple of them that we
en
have
el sitio
received
de
in
preguntas y
this
respuestas.
Q&A
Quiero
space
agradecer
of the Zoom
ante
page.
todo a toda la
I'd like to
audiencia.
thank, first
Hemos
of all,
tenido más de
the audience. We had
360
more than
participantes en esta sesión.
360 people
También quiero
that have been
agradecer
present in this session. I'd
naturalmente
also
a
like to
los
thank, of course,
panelistas y
the different
a todos los
speakers we had
colegas
and
de la
all
OPS
the
que
colleagues
apoyan
from PAHO that are
la
supporting
realización de esta sesión, a
the
Miriam
organization and
Canacoglia,
creation of
Inés
this
Smith, Paulina
session.
Paraseco,
Miriam
Anaí
Canacoglia,
Fernández, Ana
Smith,
Serrano,
Kim
Liz
Smith,
Cotter
Ana Serrano,
y
Liz
por
Cotter,
supuesto
and of
también
course
a los intérpretes
also
que
the
siempre
interpreters
nos
that are always
potencializan
helping us
toda esta
with this
difusión del conocimiento que se
information sharing
realiza
that
en
we are
estas
having here
sesiones. Bueno,
and that we
en
always
dos
have in this
semanas los
session. So,
invitamos. Hasta pronto, nos
and I
veremos.
hope I see you guys
Ya
soon.
nos queda
Thank you very
menos
much.
de un minuto.
We
Mirna,
have
por
less than
favor,
1 minute.
si
So,
tienes algo
Myrna,
para
if you
agregar.
have anything else to add,
No,
please go ahead.
repetir los
No, just
agradecimientos,
to
copio y pego
insist
tus
on thanking you
palabras,
all,
los
copy paste
esperamos
what
la
you said,
semana,
and
dentro
basically
de 2
we're going
semanas.
to
Y
be waiting
mil
for you
gracias
in a
a
couple of
estos
weeks.
eximios
And
panelistas que
thanks a lot
siempre
to these
fortalecen
amazing
el
speakers
conocimiento de
that are
nuestro país.
always strengthening and helping us
Un
strengthen
abrazo
the regional
y que tengan
knowledge.
un buen resto de la semana.
Thanks a lot and have a great rest of your week.